Let's revise high yield, ultra high yield point from breast surgery. So, most common gene mutation seen in the sporadic or triple negative breast cancer is P53, very important, and familial or aggressive or ovarian carcinoma BRCA1, main breast cancer, prostate cancer, or pancreatic carcinoma BRCA2, and in smoking, risk factor is for Mondor's disease, its chest wall thrombophlebitis. In this condition, also risk factor for duct ectasia, carcinoma breast, and Jaska disease. Jaska disease is the periductal mastitis. So mastitis is also risk factor, and fibroadenoma is not a risk factor for the smoking. Here we can see two more important things. In fibroadenoma, if they are saying completely benign, then we are giving BI-RAD scoring 2, and if non-calcification or breast mouse is, then we are giving BI-RAD 3. It's 2% risk. So, and also now we can see breast seen in the hamartoma or fibroadenolipoma. This is very important. And in this is, here we can see mitotic rate tubule or nuclear atypia seen in the Bloom Richardson index, and grade, age, margin or size games one news grading. This is helping in the recurrence in DCIS. So also lymph node is the prognostic factor for the breast, most common prognostic factor, and also grade and size. These are the Nottingham index. And risk factor of carcinoma breast is nulliparity, early menarche, and late menarche. It means wherever is estrogen is increased is risk factor for the breast. But OCP is not a protective factor, but we can't comment it's a risk factor. But for sure, this is not a protective factor. And also, smoking is also a risk factor for the breast cancer. So, in young female and lactating female, we are doing ultrasound. Okay, this is very important. And in fibroadenoma and phylloid, both are having intralobular stroma. This is the similarities. In high intensive focused ultrasound is using in treated fibroadenoma and fibroid. Both are F is coming in HIFU. So we can say fibroadenoma and fibroid. VAB, vacuum assisted biopsy, is useful for the fibroadenoma. So COW10 or P10 mutation seen in the endometrium, thyroid, or breast BAT. In cluster microcalcification and speculated margins on mammography, these are the sign of the breast cancer. So cluster microcalcification seen in the fibroadenoma. These are the Bairad's 5 because we are seen in the clearly on mammography. So we can say it's highly suggestive to malignancy. This is core biopsy needle 14 gauge is ideal. And in Paget and eczema, Paget is unilateral and eczema is having bilateral. So in eczema, lots of itching is seen, but in not in Paget. So in Paget, we are doing biopsy and see underlying DCIS, ductal carcinoma in situ. So in TIS staging is helping in the ductal carcinoma in situ and Paget's disease, but not used in the lobular carcinoma in situ. It's removed. So this is very important. And also stage T for A, T for B, and T for C and T for D. T for A is involved in chest wall, T for B skin, T for C skin plus chest wall, and T for D inflammatory carcinoma of breast. Everyone is knowing this is came in last NEET PG. More than 1/3 skin involvement. So if more than 1/3 skin so powdery orange, it's written in the question or they are specifically mentioned this, then this is the T for D staging and worst prognosis. But T for A and T for B is the important. T for A in chest wall involve intercostal ribs and serratus anterior but not involve pectoralis major or minor both. In T for B skin involvement pus, powder orange, ulceration and satellite nodules. S is for S skin or S is for second. Second alphabet is B. So powder orange is subdermal superficial lymphatics. But in skin dimpling or puckering and in Cooper ligament problem and nipple retraction in lactiferous duct issue. So these are the skin problems, but these are not involved in the T for B. These are the involved in T for C. So these are the also very important point. In next we can see lymph node staging in N1 freely axillary level 1 or level 2 level axillary lymph node, N2A, N2B. N2A is fixed or matted nodal mass. N2B, wherever is B came, it's internal mammillary. And N3A and N3C. So N3A and N3C is the opposite one. So we can remember like that vowel is coming together, A and I. So infraclavicular and C is spelled like S. C, so supra. C and supra is sound similar. So C is supraclavicular and B is both axillary plus internal mammillary. So we have to just remember infra is N3A, supra is N3C, and internal mammillary only and only N2B. And also we can say it's nipple discharge things, unilateral bloody and multiple ducts carcinoma breast, unilateral or bilateral bloody or single duct papilloma, and we are doing microdocectomy, and unilateral or bilateral or green discharge or single duct duct ectasia. In this, here we are doing head field procedure. And last thing, which is very forgettable and very important according to me, accord axillary lymph node with respect to pectoralis minor muscle. This is the, we can say, surgical classification. So here three level are involved: level 1, level 2 and level 3. So we can say respect to pectoralis minor, lateral, posterior and medial. So LPM is the trick. So level 1 is lateral, level 2 is posterior, level 3 is medial to the pectoralis minor. And also in level 1, which all lymph node is involved. So we can say I, and so I is like IPL. So in IPL we can say also APL. So anterior, posterior, lateral. And in level 2, central group of lymph node or rotor interpectoral lymph node. This is the very important, because this the not related to something, it's different. And in level 3, apical lymph nodes. So quickly we can revise: level 1, level 2, level 3, respect to pectoralis minor, LPM. If they are asking respect to pectoralis minor, then we can say level 1 is the I1 is looking like L, so we can say LPM. Lateral 2 is pectoralis posterior, 3 is medial. And if they are saying which all of them is included, so anterior, posterior, lateral in 1, central and rotor interpectoral is 2, and 3 is the apical. Thank you.